Hi guys, I'm back today to talk to you about osteopathic medicine. So we're actually going to start now talking in some detail about some of the different complementary or integrative modalities. And I chose osteopathic medicine first because of all of the ones we're going to talk about. This is probably the least integrative and perhaps one of the more familiar modalities for some of you. So what I want to do is I want to start by talking a little bit of history about osteopathic medicine. And you see on the slide here a quote from the founder of osteopathy or osteopathic medicine, Dr. Andrew Taylor Still. And the quote here reads, "There is no real difference between structure and function. They are two sides of the same coin. If structure does not tell us anything about function, it means we have not looked at it correctly." And that, again, is a quote by Dr. Andrew Taylor Still. So let's look at this a little bit of history here. So Andrew Taylor Still was actually a medical doctor who then went on, because he was fairly disgruntled and dissatisfied with the medical profession, he went on and founded osteopathy or osteopathic medicine. So you can see on the slide there that Andrew Still was both an MD and a D.O. So the abbreviation for a doctor of osteopathic medicine is D.O., or Doctor of Osteopathy. And to really understand the history of osteopathic medicine, we have to kind of get into the right mindset in terms of time frame and what was going on during this time. So you can see Andrew Still was alive in the 1800s and early 1900s. And what we have to think about in terms of what medical practice looked like in the 1800s was pretty rudimentary, right? This is pre-drugs. There are no drugs at this point, right? Penicillin doesn't show up until like right around the 50s, 1950s. So we're looking here at some pretty crude treatments here. You know, we're thinking about like using mercuric compounds as agents that cause vomiting. So basically we're using mercury, which now we know is hugely toxic. There was a common medication of that time, which was called calomel, which was basically made out of mercury. So surgery was another option, but it was very primitive. We didn't have any anesthetics at this point, short of alcohol, ethyl alcohol. There wasn't any real, well, there was no, I should say, no attention paid to clean technique, right? We're not thinking about any antiseptic techniques here. So the knowledge of the body was really not very well understood. So, the treatments that were at the hands of medical doctors at this time really weren't very good. So it's easy when you kind of put it in that context to see that you could easily be disenchanted with that practice, right? And so that's kind of where you have to understand, you have to see where this Dr. Still was coming from. So Dr. Still is a super interesting character. He was the son of a physician. His dad's name was Abram Still. He was not just a physician, he was a physician slash circuit riding Methodist minister. So he's got this like minister doctor thing going, tending to his flock both spiritually and medically, if you think of it in those terms. We were looking out, so they were living, I can't remember off the top of my head where they were living, honestly. I want to say like Midwest, but it will come to me, I'm sure, as we're talking. Anyway, so his son here, Andrew Taylor Still, he was both a medical practitioner and he was a researcher. He was a surgeon, actually, in the time of the Civil War, so that's where we are. So by the time of the Civil War, a lot of physicians were kind of looking towards what we would now consider more holistic treatments. So there was a fair number of physicians were considered homeopathic or eclectic practitioners. The eclectics is kind of a group in and of themselves. Some of you might be enrolled in the herbal medicine class as well, and we talk about the eclectics in the same time frame. So they were sort of looking for other things. You have to kind of consider, like, we're looking at the frontier here, and many people on the frontier were taking care of their own medical needs. Medical education was really offered in one of two ways. One was by a university degree, and one was by what they called reading medicine. So basically, there were some university-affiliated medical schools during the early and mid-19th century, and students obtained a course of 4 months of morning lectures to obtain their degrees. And then they could voluntarily attend another year, and it was a repeat of a lot of the same lectures. So another option was to kind of, and this was probably the more common option by many of the American physicians, was to take this alternate pathway, which was basically like learning on the fly and apprenticing with somebody that was already, an established physician. So under the supervision of an established physician, they learned technique, they read medical and scientific textbooks, they followed these physicians around, and maybe some of their other colleagues around. They accompanied them on the office visits and the home visits. So sort of like a do-it-yourself kind of, learning on the fly. You could go even further and kind of go into a more specialized tract, but this wasn't done very frequently, where you would, arrange to work under an established expert in a field. But like I said, most people didn't do that. Most doctors didn't pursue those avenues. So later on, these two kind of ideas, or these two sort of strategies, were combined to, basically consist of what we would now consider a more current system of medical education, which is 2 years of basic science and then 2 didactic years, which are kind of like, medical science and didactics, followed by 2 years of clinical work, shadowing and assisting physicians and going to the hospital and doing rounds and those kinds of things. And then after that, you go into, an additional year, multiples of years of supervised residency. All right, so that's kind of that's sort of a little bit of history on all of this. So here's Andrew Still, the son of this minister / physician, and he is in Missouri. Now I knew I'd remember it eventually. Missouri and Kansas is where they were. So they lived out on the frontier, and so this young Andrew Still is a pioneer kind of a kid, and he's doing all the things that pioneer kids do. They hunt, they fish, they butcher their own animals. So historically, the reason why I mentioned that butchering of the animals is in the history, if you read up on Andrew Still, they mention that this might have been the beginning of his studies of anatomy, the butchering of animals. And he wrote a bunch of books, and one of those books, one of his books, I think there's 4, I'll have them on a slide in a minute. One of them is an autobiography where he kind of talks about that. Also in that autobiography, he relays a memory of having, as a child, when he was 10 years old, I believe, he has this memory of having a very intense headache. And to make his head pain go away, he decided to take a nap. And so when he was taking a nap, he put his jacket over a rope swing and kind of constructed a pillow, and then he laid down at the base or he lay down with the base of his skull over the other side of the rope. So he's kind of stretched out, right, with this like rope swing kind of underneath him, kind of sort of like made a hammock, but put the rope underneath his base of his skull. And then he fell asleep. And then when he woke up, his headache was gone. And so this was like a big deal to him and made a significant impression on him. And when he years later became a doctor, the memory of that experience led him to kind of think about the relationship between the anatomy of the body and disease process, which is what osteopathic medicine is kind of all about. So, we'll see some of the offshoots of osteopathic medicine, one of which is a modality called cranial sacral therapy, which is kind of similar to what we were just describing, this pressure on the base of the skull, and then the consequence of releasing of the headache. All right, so anyway, back to Andrew Still. So he gets his medical education through this process of apprenticeship under an established physician. In this case, it was his father. He read a bunch of medical texts. He did actually attend medical school in Kansas City, but he didn't complete a degree at that point. He didn't really think that the school had a whole lot to tell him that he didn't already know. So basically, he began his career working in his local community and with his dad, with a Indian tribe. Okay, so I know the slide just went black for a second. I had a phone call. I had to stop recording. All right, so here we are. He has got his medical degree. He's working with his dad with the Indians, and he then then the Civil War breaks out, and he has, at this point, he's kind of a standard physician with what everybody's doing in those days, which isn't all that much, really. There's some medications that are limited, and he's doing anything from minor surgery to obstetrics. So then in the Civil War, he becomes a battalion surgeon, and he also served as an officer in the war. And that's kind of where things, he started, he was still pretty conventional at this point. So when he gets back from the war, he ended up having a crisis where his family, he got out of the war, his wife and 3 of his children died in an epidemic of spinal meningitis. And at the time, there were no effective medications to treat spinal meningitis. So spinal meningitis is an infection that ultimately infects the central nervous system. There's different types of meningitis: bacterial meningitis and viral meningitis. My guess, although I don't know that it was, at least I haven't read anywhere that they actually clarified which was which, but my guess, since they all died, that this was a case of bacterial meningitis, which is without any antibiotics is almost always universally fatal. So anyway, so here he's back, here's his doctor, and his wife and his 3 of his children now have died, and he couldn't do anything about it. So as you can imagine, that's gonna make you question your job and whether or not you're doing the right thing. And that was really it looks like that was sort of the straw that broke the camel's back, in the proverbial camel's back. And he went then in search of a more enlightened kind of practice of medicine. He was pretty disgruntled, and so that sort of set him on this path to find, or ultimately led him, I should say, to found what ultimately becomes osteopathic medicine. And we could probably say that the theory that he lays down was really probably the first holistic medicine. So I'm skipping around a little in my brain, I'm sorry. Okay, so he's so much such this guy is just so interesting. So essentially, and I don't know exactly, short of that memory he had with the headache, at least I couldn't find any like concrete example of, you know, something that turned, you know, a patient case that really opened his eyes to something else. But, you know, he was just kind of an interesting guy, and he had, you know, this really sort of spiritual side, right, because of his connection to the Methodist philosophy. And so, you know, the Methodist philosophy really was focused on working to attain perfection. And and in this process of working to attain perfection, he kind of like bridged the idea of what ultimately became known to be natural evolution or evolution. So the early evolutionists really suggested that there's a natural process, there exists a natural process that kind of pushes us towards perfection of any organism, and the human being, of course, is the highest naturally evolved life form. So Dr. Still felt that the human being was really perfectly constructed. And then he wrote a lot about that. Like in his books, he writes a lot about the God of nature and the great architect and the great engineer and the great mechanic and all of this stuff, right? And he really did talk a lot about the human body being perfectly constructed as like the highest form of a machine, which I actually personally agree with, right? The human body is unbelievably designed. You know, you can't imagine how incredibly complex and intricate the human body is. And so when you really dive into looking at the human body and anatomy and physiology and form and function and how all of this works together, it's hard not to say, wow, this is a perfectly designed machine, right? Almost perfectly designed machine. So that was kind of where he was coming from with all of this. So, you know, and you have to kind of think that we're now in the 19th century, and so there's a lot of engineering going on, lots of mechanical developments, progress is being made, and Andrew Still was known to be also quite an inventor. He invented a bunch of different things in his lifetime. And so all of this kind of starts fitting together. So even before the Civil War in the 50s, it looked like Dr. Still was experimenting with some sorts of manual medicine, manual treatment, manual meaning with the hands, right, structural. And then after the war, and of course after the death of his wife and his children, he really started to kind of sew this whole thing together into like a pretty unified philosophy regarding the cause of illness and how to treat this. So, you know, now we're in like this 1870s. I believe in 1874, maybe his autobiography may have been published, if I remember correctly. And that's where he really like sort of outlined the whole premise here of osteopathy. And so his new methods really centered around hands-on treatment, adjusting the positions of the joints, the levels of the muscle tone, enhancing circulation of all the body fluids, blood, lymphatic, cerebral spinal fluid, improving the efficiency of the respiratory system, and ultimately improving the host's response to disease. So here it is. So this is what I was just telling you. I'm sorry, I didn't have that slide up. All right, so this is all happening after the war. Everything kind of starts coming together, right? He's doing the manual treatment, and then before the war, then he starts to kind of really sew this whole thing up into a pretty complete philosophy. And again, just because it's on the slide here, it's based on hands-on treatment, adjusting the positions of joints, the levels of muscle tone, enhancing circulation, improving the efficiency of respiration, which in turn improves the patient's response to disease. All right, so this term osteopathy comes from Still being used. Osteopathic medicine, osteopathy, doctor of osteopathy, D.O.S. We still use all of these terms. The term was coined, it looked like around late 1800s, from the Greek roots. Osteon means bone. Pathos is like the study of, essentially. So the first school of osteopathy was founded by Andrew Still, and it was called the American School of Osteopathy. It was, again, founded in 1892. And the central tenet of the school was to treat malpositioning of the bones and joints, especially in the spine, affecting both circulation and nerve function, which ultimately opens up the patient to disease in the tissues if you have malpositioning of the bone. And so it kind of like all goes down to, in terms of disease, etiology or causes of disease, all goes down to, you know, things being out of whack, right? Everything is connected, right? This is all the holistic stuff that we've been looking at, right? This is the early bit of it. So this didn't fly that well, as you can imagine, right? This was not, he wasn't really accepted for this. And actually, if I remember correctly, he was pretty much ostracized in Kansas because he left the sort of like conventional medical fold. And he was, if I remember correctly, he had to leave. And you know, he kind of got thrown out by the, he kind of was trying to teach his new ideas at a university in Kansas, which was a Methodist university, that he thought would at least be sort of open to his ideas because of his history, right? His being the son of a Methodist minister. But, and if I remember correctly, his family actually donated the land to start the university. It's Baker University, or was Baker University in Kansas. However, that didn't go over as he expected, and he was actually kind of ostracized. And the congregation kind of said that the local minister told the congregation that his practice was of the devil, and only Jesus was supposed to be able to lay on hands and heal the sick. Because remember, like, this is the first time, like, he's putting hands on somebody, and so that was kind of where the problem lied, I suppose. All right, so he leaves. He got pretty sick. He ended up going back to Missouri, and then he started to see some people, and they started getting better, and so word sort of started spreading, and people started coming to where he was living in a town called Kirksville, and they started coming to him. And that's, again, where this kind of practice became, like, early on, before he called it osteopathy, he called himself a magnetic healer. I don't know exactly why he chose that, but he then changed that. On something I read, I'm reading a note here, on something I read, he used a business card, and on his business card, he called himself a lightning bone setter. Anyway, I think osteopathy, worked better. So, the approach was this, using the bones and the joints as kind of the starting point, you know, again, saying that if the bones and the joints were out of whack, especially in the spine, then that's going to mess up circulation and nerve function, which is true, and then people can end up getting sick. All right, so you can see that's a picture of him down there as well. So the theory of the osteopathic theory emphasizes the integration of the body's communication and regulatory mechanisms, the inert defenses, and healing powers of the body. The special role of the musculoskeletal system in relationship to organ systems is an emphasis on health promotion as well as combating disease. So, you know, like I said, where he really started laying this out. The body is a highly complex machine, which I would totally agree with. And like any other machine, you gotta align it, right? You gotta lubricate it, you gotta take care of it. And so the focus was on removing any of these mechanical blockages to free up the flow of fluids and nerve impulses. So where the rubber meets the road is really this relationship between structure and function, and that's what that is considered the key in the development of the disease, and it's really a foundational aspect of osteopathic medicine. So Andrew Taylor Still wrote 4 books. The first was an autobiography. I alluded to that in a minute ago. The second was a book called The Philosophy of Osteopathy. The third is The Philosophy and Mechanical Principles of Osteopathy. And then the final was Osteopathy, Research and Practice. And that was published in 1910. So in the books, he kind of outlines all of his, the autobiography, of course, describes his life and how he developed osteopathy. And then the next couple are really kind of taking his philosophical ideas and, sort of linking them to what what was going on at the time, what they knew about physiology at the time. And again, that wasn't a whole lot. And then in his final book, he really expanded his ideas and really sort of dove into some of his treatment techniques. And in the books, you see that he did still on occasion use medication, although not very often. He was really opposed to the use of opiates and alcohol because he saw a lot of abuse, especially in the war, which makes sense. He thought it was not a good idea for physicians to dissolve medications for their patients in alcohol because that could lead to dependency. He talks a lot about manipulation to kind of take the pressure off anatomical and structures, and ultimately then to take off physiological stress on the system. And when you do that, the body will return to a state where it can basically cure itself, right? That's the holistic philosophy. Remember, we laid that out. That in order to be called a holistic medicine, you have to sort of buy into the fact that the body has the potential to heal itself. And he very definitely did that as well. All right, so this, like I said, it didn't go over that well. The allopathic profession, so now we're like in the early 1900s, the allopathic profession was getting pretty good. And if that term's not familiar to you, allopathic conventional medical MDs are allopathic physicians. That's what that term means. So that profession was getting, more established. And they really held a monopoly on training, medical training, and licensure, and they were not into osteopathic medicine at all. So they vigorously fought the new osteopathic profession. They were not fans, which you could make sense. You could understand, right? This what we'll see as we go through our course. And I think this is the biggest problem that we have currently with the integration of holistic practices into the medical model. Is there's lots of turf wars, right? This is a very divisive situation. It's not inclusive, and if we could switch from being so divisive to being more inclusive, we could take the best of all of these practices and really, sew up something that makes a lot of sense. But that's not the way it kind of has played out in history. So the osteopaths were being fought vigorously by the allopathic physicians, but they had followers because they had knowledge. They had the special expertise in neuromuscular conditions where there wasn't, at this time, there weren't physical therapists. There wasn't any physical medicine. There wasn't rehabilitation and all that stuff. So the osteopathic physicians filled that niche that desperately needed to be filled. And because of that, their field expanded quickly. And, you know, they started forming new schools. Graduates of the first school of osteopathy, the American School of Osteopathy, started forming new schools, and they really started building the profession, which interestingly enough, drew some pretty impressive supporters. One of whom was Teddy Roosevelt, President Taft, Mark Twain. I have a quote from Mark Twain somewhere in here. We'll see it. Mark Twain actually testified to the New York State Assembly in favor of osteopathic licensure, which was interesting. So anyway, there was some fighting going on, and there was a couple things that really pushed this profession forward. Dr. Andrew Still died in 1917. And so after his death, you know, there was a couple things that happened that were significant. One of which was during 1919, there was a pandemic of Spanish influenza, and this really put the osteopathic physicians to the test. And it turns out that they did great. The results were excellent. The medical profession, we're still at 1919. We don't have any antimicrobials at this point. So the medical profession doesn't have much. They have drugs to, you know, decrease cough. They have opioids for pain and sedation. They have strychnine to stimulate the heart, none of which is going to be all that helpful in the case of a Spanish influenza. So osteopaths, though, they honed their treatment at looking at the autonomic nervous system. They were able to increase blood delivery, which what we know now is how we get how immune cells travel around in the blood, white blood cells, antibodies, etc. Lymphatic drainage helps to clear things out that are dead and damaged. With the Spanish influenza, there was a lot of respiratory compromise, so their ability to improve respiration by the biomechanical manipulation really helped. So it turns out that the osteopathic physicians had dramatically lower morbidity and mortality rates than their allopathic counterparts. So that was super cool, right? That really helped a lot. Another thing that was happening at the same time was, again, the allopathic medical profession was also improving, right? After World War II, the medical college standards began to improve. They started thinking about antiseptic procedures. We saw the development of sulfa antibiotics. Penicillin hits the market early and didn't really go mainstream in 1927. A lot of the people who were studying under Andrew Still prior to his death were actually MDs, but they didn't really want to throw out all of their knowledge, but they wanted to incorporate some of his ideas and enhance the self-healing powers of the body. Another thing that was happening in osteopathic medical college is they were teaching materia medica, which is basically the herbal part of this. So they were looking at herbs, and they were able to incorporate some of that knowledge in as well. Okay, so most osteopaths were considered general practitioners, and actually that is still true today. Another thing that happened with the osteopathic profession is that during World War II, osteopathic doctors were not allowed to serve in the armed forces as physicians, but consequently they stayed home and they cared for the patients whose MDs were overseas. So most medical doctors at this time were sent overseas. My grandfather actually was a medical doctor at the time, and it was sent overseas during this period. So that was not uncommon. So the osteopaths weren't allowed to go, so they stayed behind, and so they had to kind of pick up the slack. There weren't very many doctors around, so the patients had to see somebody, and so who they were seeing were the osteopaths. So that helped the growth of osteopathy tremendously. Patients were happy, and they saw, and you know, it helped to kind of potentiate this profession as being very valid, and also that showing that the osteopaths were well trained and they knew what they were doing. Another thing that happened is post-World War II, a lot of the returning soldiers attended universities in huge numbers, boosted by the GI Bill, and record numbers of students enrolled in osteopathic colleges. Okay, so probably one of the most significant things happened in 1953 when the president of the American Medical Association basically called for a report and received a report on the status of osteopathic medicine, which ultimately what it basically came down to, they said that in this report they indicated that osteopathic training was equivalent to MD training. And that was a way that essentially what that did is it allowed the government then regulated that the osteopathic profession be credible. And in the state of California, the osteopathic profession, merged with the allopathic profession. Not in every state, but they did in California. And that it was interesting. So essentially what came out of that is they were essentially said to be possess the similar scope of practice and have equivalent training. So that was very significant. And I think I told you, I'm not sure if I just said the date, but that was in 1961. Not all of the osteopathic profession was super stoked on being kind of like grandfathered into to the MDs, because they felt that they were, you know, a standalone profession. So that didn't happen in all states, and not all osteopaths were really excited about that. But in California, that's what happened, and it seemed that it definitely helped the osteopaths, because prior to that time, it was very difficult for osteopaths to get like hospital privileges. They weren't able to admit patients to the hospital. So consequently, osteopathic hospitals came out of that. So they had osteopathic physicians had their own hospitals, and there are still some osteopathic hospitals. But then essentially what ended up happening is voters were convinced to support a plan under which no new osteopathic licenses would be issued, and instead any DO could trade their degree with an additional $65 to get an MD degree. And about 2,000 DOs did that. So they basically like just traded up, if you will, their degree. So that was kind of interesting. At the same time, a whole bunch more osteopathic medical colleges were established. 10 more between 1969 and 1981. There was in Los Angeles. I'm in Los Angeles, so there was a College of Osteopathic Physicians and Surgeons at Los Angeles. That's what it was called. And it was transformed into ultimately an MD granting institution, which then became affiliated with the University of California at Irvine. So that's kind of an interesting history. Again, that really helped. But like I said, not all osteopathic physicians really wanted to kind of be considered MDs, but that's just sort of essentially what happened. So basically, at the end of right around 1980, we basically say now that the osteopathic doctors and the medical doctors are essentially equivalent. Even though, and I think this is important, and this kind of is a point of contention, depending on who you talk to. you know, even though the osteopaths historically have this bend towards manual medicine, no pun intended, right? That's a big part of their history. And by kind of grandfathering them in, and what unfortunately has happened from my perspective in many osteopathic colleges is a lot of that manual medicine is lost, which in my opinion is a big loss to the profession. Because if you can find a good osteopathic doctor, and they're pretty old school at this point, that's very well versed in manual medicine, along with all the other current medical practices, you've got it. That's a great marriage of skill sets, in my opinion. Okay, so I'm gonna stop this video, and I'm gonna start the next one on discussing some of these potential offshoots of osteopathy, and then we'll talk some more about osteopathic medicine.